Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Venditti, our hospital system general director. Today is Incident Command Day 40, giving you the update from Albany Medical Center on the coronavirus. We are reporting in the 5 counties the number of patients that have tested positive for COVID-19 is 1,297. That's about a 3% increase from yesterday. Fred, that speaks a little bit about the doubling time.
It does. So again, as we've been saying for a couple of days now, Dennis, the doubling time is getting longer. And so we're really not seeing the kind of surge that New York City has seen. And we've been sharing information with the other hospitals and putting that into a model, and the model doesn't suggest that we're going to see a surge anytime soon.
In the beginning of this, we were seeing 10%, 20% gross day over day.
Yes.
3% is definitely
Which is
lower.
a much shorter doubling time over just a couple of days, as opposed to probably now we're up to 20 days of doubling time.
Inside here in the medical center, we had the same number of inpatients as we did yesterday, 62. We had the same number that were admitted as were discharged. That breakdown is 35 on the floor, 27 in the ICU, 20 on the ventilators. Again, that number still remains low.
Yes.
Okay. Let's talk a little bit about those 62. Yesterday we reported 6 different units were caring for patients. Today we have a 7th unit. That's B3 West. They currently have 2 patients there. Having 7 units might speak something about our tier level. What tier level are we at right now?
So Dennis, for med-surg we're at tier level 2. For the critical care we're still at tier level 3. So those haven't changed. But if those patients on B3 West get discharged the next couple of days, we'll probably drop down to tier level 1 for med-surg.
We've also had 86 patients from the beginning that have had COVID-19 who've been admitted to the hospital and have been discharged to home, which is great. They're breathing on their own, they're off ventilators. Give us an update on those numbers.
That's right. So of the 86, 72 have been local patients who've gone home locally, and the other 14 are patients from New York City that were transferred up here, a few days and a few weeks ago for care. So actually right now, Dennis, we only have about half of the transferred patients still in-house. So 14 of the patients out of New York City have been discharged. Unfortunately, 8 have died up here at Albany Med. And if I could just take a moment, yesterday we talked a little bit about palliative care, and I did a shout out to some of the physicians who are working in palliative care. I did a shout out to Mike Jones. I did a Dennis McKenna. Actually, it's not Mike Jones, it's Tony Jones. So I apologize, Tony, you're doing a great job.
Thank you, Tony. We have some great news to report on today. Let's talk about some face shields that have been made for us. These are face shields that have been put together with the collaboration of thank you very much, the Center for Disability Services and the New York State Industries for the Disabled. I want to thank Maureen O'Brien, who is the CEO for NYSID, and Greg Sorrentino, who is the CEO for the Center for Disability Services. These are 2 incredible not-for-profits, and the collaboration is great. Let me talk a little bit about why this is so important. The people who put together these face shields are people with disabilities, and it's very important for them to have meaningful jobs. And not only has it helped them, but what they put together for us is really going to be very helpful for our front line, and Fred's going to explain why.
This really is tremendous, Dennis. These face shields are going to be used by our frontline staff who are caring for COVID patients, and what it does is it protects the mucous membranes of their eyes, which is a way for the virus to get in, and it also protects the masks that they're wearing. And as we're trying to extend the use of masks, it's very important that those masks not get soiled or contaminated when patients are being cared for. And if I could just reiterate our policy around masks. So we are providing masks now as our staff come in. When they are going to be directly interacting either with the public or with patients, we're giving them masks to wear. We want them to wear those masks until they get soiled or for some reason they have to take them off. We want to make sure that they wash their hands before they put their masks on, and also when they take their masks off. And I think there's another important point for us to make. We're really trying to conserve masks, and some of the visitors who've been here at the medical center, and even some of our staff, have asked for masks as they're leaving the medical center. We really don't have enough to provide folks masks for their use at home. We understand what the governor wants everyone to do, but we can't be the supplier of those masks.
Okay, very good. These shields are going to come Monday, so thank you again, New York State Industries for the Disabled, Maureen O'Brien and her incredible team, Center for Disability Services, Greg Sorrentino and his incredible team. 800 of these face shields are going to come Monday.
Fantastic.
Which is going to allow all the members of our team to have one, which is wonderful. And we thank them for their incredible leadership. And that is some great news. Speaking of donations, we are wearing coverings here today that my wife had made for us. It has our names on the side in case anyone would have us confused. These are the types of coverings that I think represent our operative or procedural services.
That's right. And I think Karen thought our hair was getting a little long. That's why she made these caps for us. She did notice I actually got a haircut last weekend. My wife, Mary Ellen, who's a great endocrinologist, also turns out to be a pretty good barber and gave me a little bit of a trim, but I'm wearing the cap anyways.
Well, thank you for those. Let's talk more about some good news. We're going to end Friday on good news. Convalescent plasma. We talked about how the number of donors was going up, and today we can report that we have matches for
21 donors. 21 donors.
Incredible.
It's just incredible.
We talk about service here inside the medical center, all of our staff helping in this pandemic. We have a couple members of our workforce that are in the military. I'm in the military and I love military service. We'd like to call out two in particular. There's probably others, but we'd like to thank two that we know of who have been activated to active duty and are serving in this pandemic. Fred, you can go first.
So Mia Menon is a lieutenant commander in the Navy. She's actually one of our pediatric surgeons, and she's serving down in New York City on the Comfort.
Very
It's tremendous.
And our chaplain, Chaplain Jake Marvel, we call him Captain Marvel. He's in the U.S. Air Force, and he is down in New York City. In fact, he was at the Javits Center, and he was providing Easter services to the folks down there working. So we thank Chaplain Marvel as well for him and for Dr. Menon as well.
Great.
Fred, what is Code Lavender? Code Lavender.
So Dennis, the nurses and other staff in the critical care areas are working really hard, and they're caring for some very, very sick patients, and unfortunately a lot of them have died. So that's kind of hard work, both physically as well as mentally. So every 4 hours we're actually almost forcing them to take 15 minutes, go someplace quiet, and really kind of take care of themselves. So that's what Code Lavender is. It's really a little break for the staff in the critical care areas.
Okay. It's about taking care of your staff. And the last thing we want to talk about today is a shared leave policy. This is a new policy that the medical center has just rolled out. And what this is going to do is it's going to be an opportunity for employees who wish to donate their earned time off into a pool or a bank. And that bank of days can be drawn down upon by an eligible employee if they apply for it and if they have reasons related to COVID-19. So it's a way for us to share those resources with ourselves.
That's right, Dennis. I think this is going to be very important. This has been sort of a stressful time for a lot of folks, including our staff. So having this as an opportunity for them, I think is really going to be wonderful.
And we know that our workforce is very generous. I know, Fred, you've talked about already, you're going to donate days.
I'm going to donate days, and I think you're going to donate days as well, Dennis.
I am. So, and we look forward to others doing the same thing. It's Friday. We're going to end on this. We asked you earlier in the week if our workforce could send pictures of rainbows. We see them in the windows. We see them on the walls. This is a way in which we're showing to the community that we're united. All of the pictures that were sent in will be available and on our intranet landing page, and you can look for those there. But to everybody who sent videos in, thank you. To everyone in the community who's supporting us, thank you. I think you'll get as much joy and satisfaction out of seeing these pictures as we did, because it's really about the spirit, not only inside the medical center, but out in the community. So thank you very much. We will certainly be working here on this weekend, and we'll be back on Monday. As always, we ask that you please take care of yourself, take care of each other, and we will see you Monday.